I was walking to the mailbox, and I got to the mailbox, and then I thought, oh, you know, I need to get something out of the car. And about halfway across the lawn, my legs got really, really heavy. And I thought, oh, what's up with this? I just had stents put in my heart. I should have blood flow like crazy. I should be feeling great. And instead, I feel like some little old man, you know, shuffling my legs because I can't move them fast. They didn't hurt, they were just heavy. And so at that point, I thought, well, I need to go back and see my cardiologist. And so I went to see Dr. Roth, and he said, you know, this is not a heart thing. This is a blood flow thing to your legs. And he said, you need to see a vascular doctor. So he sent me to Dr. Stilp, who most probably had been here for a New York minute. I may have been his first patient. If I wasn't his first, I was certainly one of his very, very first patients.
Lee had reported that his legs were bothering him, first at long-distance walks and ultimately at quite short-distance walks. He would get heaviness, cramping, burning sensation, really from his thighs to his calf muscles, needing to rest to relieve the discomfort, and as soon as he started doing something similar again, the discomfort would come back. It's a classic sign called claudication. That is a sign of significant blockage in leg arteries. You think about blockage in your heart. I have 4 stents in my heart, you know, so it's, you know, you think about those arteries needed to be stented, but I've never thought of ever once about that you have that same thing here, you know, that goes down your legs. Lee is somewhat of a legend in our hospital because he told his nurse in the preoperative area that he was going to have both legs fixed on the same day, which the nurses are quite aware doesn't happen very often, and kind of we're trying to tell him that it wasn't going to happen that way, and sure enough, that's what happened, and he got nice relief on both legs with a single procedure.
He was the doctor that you always dreamed about having, who was not only proficient at what he did, but up on everything that was new and important to know how to do. You know, so he brought Dr. Stilpness, you know, to Columbia St. Mary.
Our journey to tertiary cardiovascular care at Ascension Columbia St. Mary's is centered on the opening of our hybrid operating suite. It will be the home of both minimally invasive and open surgical procedures for patients with electrophysiology problems, cardiac surgery problems, endovascular or peripheral vascular problems, aneurysmal disease. It's going to provide the ability to treat patients in a setting with the highest degree of technology and the highest degree of safety in the event of emergency. Lee's case was fortunate. A referring doc makes an accurate diagnosis and gets Lee to the specialist he needed in a timely fashion, and we were able to impact his symptoms quickly with a procedure and ultimately decrease the likelihood of progression to a more serious state. Unfortunately, in our community, there is an incredible amount of misdiagnosis or underdiagnosis of peripheral arterial disease. The symptoms can go undiagnosed or unrecognized for an indefinite amount of time. Patients don't realize that the discomfort they're experiencing in their legs when they're walking, or the pain they're feeling in their feet when they're trying to sleep at night, is the first sign of significant leg artery difficulty. And left untreated can progress to debilitating ulcers that won't heal, incredible risk of toe and foot and even entire leg amputations if untreated. Our goal is to get everybody in the office at the same time that Lee was referred, at a time when improvement is relatively easy and prevention of progression to limb ischemia or limb-threatening ischemia is relatively easy. Our Be of Good Heart program is doing an excellent job in Central City, Milwaukee, and in the near North Side neighborhoods in identifying patients with risk factors for cardiovascular disease early and connecting them with the appropriate cardiovascular provider. And our goal this year is to expand the Be of Good Heart program to include community screening for peripheral arterial disease.
Come here. On a gorgeous day like this, there is nothing I like better than to be able to take the dogs into the backyard or take them for a walk around the corner, and just playing with the dogs, running around, playing with them is just absolute bliss for me. Come here, baby girl. I mean, every person that I talk to who has heavy legs, who thinks that it's just something that you get when you get older, I want them, I beg them to go see a vascular guy, because it may well be that they just have blockage, and if it's caught early, it will change their life. Because it did for me. And once I had this done, and the life-changing aspect of it allows me to do things that I could do when I was young.